Assalamualaikum and good day. My name is Amrina Rashada binti Abdul Razak, and for today my presentation is about KPJ Healthcare Berhad background and issues in change and development faced by KPJ Healthcare Berhad because of COVID-19. KPJ Healthcare Berhad, or also known as Kumpulan Perubatan Johor, is a Malaysian leading provider of private healthcare services. It is also recognized as first private hospital in Johor on 1981. The core value of this organization is safety, courtesy, integrity, professionalism, and continuous improvement. It is consists of more than 28 specialist hospitals located through Malaysia, with 2 hospitals in Indonesia, a sizable share in Hospital of Bangkok and a hospital in Bangladesh. This organization has resilient business model drawn from 38 years experience in Malaysia private healthcare industry. Kumpulan Perubatan Johor mission is to be the preferred healthcare provider, follow with their mission, which is to deliver quality healthcare services. Even though KPJ is a big and well-known organization, but they also facing change and development issues during COVID-19. They are also affected by the pandemic. One of the issues faced by KPJ is the need for real-time redesign of care model for patients. During COVID-19, the amount of those who are contagious and infected are very high and rising in amount. From January 2020 until January 2023, there have been more than 5 million confirmed cases with 36,000 total deaths in Malaysia. And from this case, it is necessary for the physician, nurses, and others to discover appropriate care model and room design for the patient. When the number of patients are arising, for sure there will be not enough space for the hospital to admit all the patients into one place. And this will cause the workspace for the nurses, physician, doctor, and others getting tight and cramped area and making it difficult for them to do their work. Other than that, KPJ also experienced a drop in admission because of patients who are not infected by the COVID-19 generally stay away due to fears of being infected. As we know, hospital is the most risky and easy to get infected place for those who are not infected with the COVID-19 yet. Most private hospitals experience a decline in revenue due to postponement of elective and non-urgent treatment due to COVID-19 and a fall in amount of foreign patient volume because of the restriction of international traveller, which is they are remain to be in their places. During the pandemic, KPJ also did not miss from the common issue during pandemic, which is low productivity and burnout of the employee. Low productivity issue occur because not only patients are infected with the COVID-19, but the doctors, nurses, and other medic teams are also infected. Besides that, they are also facing labor shortage while the number of patients are increasing. Most of the staff who have been a frontliner facing a burnout since they did not have enough rest and need to cover those who have been infected at the same time with the lack of the facilities needed.
Assalamualaikum many Iman channels and friends. My name is Noridaya binti Jasni. Today in this presentation, I will present about the intervention of KPJ Healthcare Berhad toward in the issue in telemedicine. What is telemedicine? Telemedicine is a one online platform which gives patients an option to connect with doctor for consultation. Telemedicine is used to make it easier for patients to communicate with doctor online and in the comfort of their own homes. This telemedicine was introduced as one of the ways to reduce the rate of patients coming to the hospital. And in addition, it also helped to reduce an infectivity rate of the COVID-19 virus outbreak. This telemedicine was introduced to make it easier and safer for patients to receive a follow-up treatment and consultation. How to use a telemedicine in KPG. The telemedicine online consultation service is only for existing registered patients with KPJ Hospital who are already under KPJ doctor's care, as a telemedicine online consultation is considered as a continuation care of a service for patients. Telemedicine is the best suited for patients who are unable to leave their home for any reason and would still want to get connected with their doctor. Telemedicine is provided through the Google Meet application, which allows to consult doctor from whenever you are and agree times and appointment has been confirmed. Patient is required to have a valid email account in order to book the appointment successfully. Telemedicine consultation will be carried out via a video conference tools, Google Meet through a calendar of appointment. A consent form is required to be completed by patient before a telemedicine relative or legal guardians allowed to request on behalf of the patient if the patient is unable to do so. The telemedicine service has a minimal upfront consultation fee with the doctor. However, if required on the prescribed medication, the charge will be separate. The upfront payment of the service is of 115 ringgit, which is comprised of 105 ringgit Malaysia for consultation fee and 10 ringgit for administration fee. All payments should be made before the telemedicine service appointment.
Assalamualaikum to Meda Ima and friends. I'm Nur Fatima. I will cover the effectiveness of action was made by KPJ Healthcare Berhad to overcome the issues and the recommendation about the action for the future. According to New Straits Time New Online, KPJ launched telemedicine, a technology-enabled initiative to encounter their issues, where they reshaped the healthcare IT platform in 27 out of 28 hospitals. This is the successful changes toward KPJ Healthcare Berhad. Telemedicine is the one of medical operating protocols that have been modified in KPJ Hospital to reduce contamination risk, to provide a safe working environment for healthcare workers, and making the patient feel safe. According to Dr. Aidil Nurufarina, telemedicine emerged as a critical tool in providing continuous medical care to patients while attempting to reduce the transmission of COVID-19 among other patients, clinicians, and families. Telemedicine avoid direct physical contact, thus reducing the exposure to respiratory secretions. As during this pandemic, physical distancing helps the limit the spread by breaking the chain of transmission. Moreover, telemedicine relieve the massive workload partially from the workers in the hospital, protecting patient and healthcare workers from exposure to the virus. Research conclude that majority of the doctor agreed telemedicine was useful and they experiencing a reduction greater than 50% in outpatient visit during the COVID-19 pandemic, as stated on the MBA blog in April and May 2020, had resulted a decrease in patient numbers and bed occupancy rate. This pandemic gave a fresh push for the healthcare industry to advocate telemedicine other than remain active in providing core service. Based on our opinions, we totally agree with the interventions that have that has been made by KPJ Healthcare Berhad. Because of pandemic COVID-19, the patient have limited movement because of movement control order MCO and highly admission of patient with COVID in the hospital. Therefore, telemedicine is the best way to keep their patients' demand with no interruption in their capability and capacity in caring their patient during pandemic in a safe condition. As stated on KPJ website, using telemedicine can make cost and time saving. Patients will spend less time on waiting in line and save time and risk on travel. Moreover, telemedicine is quite convenient when medication straightly delivered to the patient's house during pandemic period. It thus minimizing the attendance of patient to the hospital has a significant impact on the cost of patient care. Plus, as promised by KPJ Healthcare Berhad, by using telemedicine, patients' privacy and medical records are protected and secured. Here, the recommendation that related with the telemedicine in the future. Research stated that changes have reluctant and rejection because of negative perception, pool of knowledge and skill in practicing telemedicine, and seniority age among workers. Therefore, the success of telemedicine depends on improved access, enhanced quality, and cost containment. Here are some recommendations. First, the implementation of telemedicine must be a government initiative. This will allow for standardization of guidelines and larger access to the public. The benefits of the centralized system with the government support have been shown briefly during this COVID-19 pandemic through the initiation of online tracking applications such as MySejahtera apps and Selangkah apps. These apps have been able to rapidly attain widespread use throughout the country through extensive media coverage and issuance of incentive for downloading this application. The benefits of this government-supported telemedicine initiative have seen similar responses in other countries such as Taiwan, Korea, Singapore, and China. Second, telemedicine need to financially viable for both healthcare providers and the public. Policymakers and insurance providers should provide clarity on reimbursements on the various telemedicine encounters and turn away from the traditional pay models. This has been observed in multiple countries such as United Kingdom, Germany, Sweden, France, and Australia since the start of COVID-19 pandemic. In those countries, government and insurance companies have moved with an uncharacteristic speed to have various teleconsultations covered. And last one, the education initiative would be needed for both clinicians and the public. As for clinicians, they should be informed about developing legislation and regulatory developments in telemedicine through conferences and seminars. For the public, there needs to be more spreading of information from healthcare providers, schools, and professional associations regarding the healthcare resources and support available through telemedicines.
Thank you, my friends. Assalamualaikum to my lecturer. My name is Adrina Balwanadia binti Muhammad Salihuddin Kala. So, our group topic, Change and Development in KPJ Healthcare Berhad because of COVID-19. We come to the conclusions that telemedicine or telehealth is another term for the distant healthcare delivery, employee electronic information, and technologies such as computer, camera, video conferencing, satellite, wireless connections, and the internet that is rapidly increased every day in the field of medicines. KPJ believes that by altering the customer experience, digital technology will assist to boost their service offering. The most significantly impediments were medical legal challenges for KPJ are caused by the lack of suitable legislations, compensation for service, technically difficulty, patient education, and desire to participants. Government involving pricing consistency and education program are among the ideas to enhance telemedicine acceptance. As a result, while the COVID-19 pandemic appeared to increasing physical perceptions of telemedicine's readiness to utilize, in reality, considerations implement remain, and few doctors would genuinely implement telemedicine in Malaysia. With the pandemic changing entire industry landscape, KPJ believes that some of its impact will last. And as a result, the next level customer service will take a hybrid shape. Integrations elements of online and physical contact. The group digital transformation plan will continue to harness industry technology to accomplish this. So that's all for us. Thank you.